So my name is Patrick McKeown. I'm from Ireland, and over the next few minutes we're going to talk about snoring and sleep apnea and the link which dysfunctional breathing patterns have towards these conditions. When we consider snoring, it's the exchange created from turbulent airflow. So it's noisy breathing during sleep, and it's caused by the exchange of a large volume of air through a narrowed space, which in turn causes the tissues of the nose and the throat to vibrate. Now, we looked at two aspects there. One is the large volume of air, and the second is the narrowed space. Generally, when we consider snoring, we think only of the airway. But if we think of the airway, we also need to consider the flow, because airway size is relative to flow. And factors of modern life, including stress, including overeating, including lack of exercises, including the belief that it's good to take in big breaths, all of these factors, they change our breathing volume so that our breathing becomes heavier. And how we breathe during the day determines how we breathe during our sleep. So when we sleep at night, our breathing is more noticeable. This is the exchange of a large volume of air through a narrowed space. And what my work is, it involves changing breathing volume down towards normal so that breathing is lighter and quieter and gentle and through the nose during sleep. Then we have to address snoring, and we also have to address obstructive sleep apnea. The next progression, of course, to snoring is obstructive sleep apnea. It's very common here in the United States. It's very common in the Western world. It's estimated that probably it's affecting about 30% of adults, so 1 in 3 people. And when we consider normal breathing volume, normal volume of breathing is 4 to 6 litres of air per minute. We know that people with breathing disorders, including asthma, are breathing 10 to 15 litres. We also know that people with sleep apnea are also breathing 10 to 15 litres of air. So people who are snoring, people with sleep disorder breathing, are breathing too much. And when we consider, obstructive sleep apnea, one principle from engineering is called the Bernoulli principle. And it states, as fluid flows, a negative pressure develops at the periphery of the flow. And that as the flow velocity increases, so does the negative pressure. Now, if we think of in terms of obstructive sleep apnea, here are the upper airways, and here is the area that's prone to collapse. If we think of this as a collapsible paper straw, and if the individual is breathing heavy, they're taking a large volume of air through, so as the diaphragm contracts, breath is drawn into the lungs, and as breath is drawn into the lungs, it creates a negative pressure in the upper airways. Negative pressure is contributing to the collapse. The Bernoulli principle states that as the velocity of the flow increases, so does the negative pressure. So an individual who is breathing too much and breathing faster is creating a greater negative pressure in the upper airways. And just as the CPAP machine, that works on pumping positive pressure into the airways. The question that I would like to put out there is, if we reduce the negative pressure, can we in turn reduce sleep apnea? So if breathing volume is brought towards normal, the negative pressure is reduced and the apneas will reduce. The first step to addressing sleep apnea is look at the nose. And nasal stuffiness, rhinitis, chronic rhinitis, it's rarely found in isolation. It's been documented that people with rhinitis and children, they're more than twice as likely to suffer problems due to their nasal allergy symptoms. And here we look at a paper, open mouth breathing during sleep is a risk factor for obstructive sleep apnea and is associated with increased disease severity and upper airway collapsibility. And there are quite a few studies looking at what happens to sleep apnea when we breathe through the mouth versus when we breathe through the nose. This study here, it tested the hypothesis that a mechanical advantage might explain this preponderance of nasal over oral breathing during sleep. During sleep, upper airway resistance was much higher while breathing through the mouth. But in addition, obstructive apneas and hypopneas were profoundly more frequent when breathing through the mouth versus breathing through the nose. Now the difference was 43 when breathing through the mouth and 1.5 when breathing through the nose. And that is a huge difference just by getting the mouth closed. Here is an article looking at For example, one individual who was wearing the CPAP machine versus the individual when he wore the chin strap from the CPAP machine. And it was found that not only did the chin strap achieve an improved apnea-hypopnea index as compared with CPAP, but it did not provoke the onset of complex sleep apnea noted on the first PSG study. So basically the chin strap, that's designed to get the mouth closed. When we get the mouth closed, breathing is through the nose. When breathing is through the nose, airways are open. When airways are opening, there's less likelihood of sleep apnea. In terms of children, we know that sleep disturbances, poor school performance, and hyperactivity are all mental complications seen in many children related to the nasal allergies. So there's so much documented evidence showing the link between nasal obstruction, poor breathing, and sleep disturbances. And it's great news that one of the founding fathers, if not the founding father of obstructive sleep apnea, Dr. Christian Guilleminault, in the 1970s, he determined that there was a link between individuals holding their breath during their sleep and high blood pressure. So he teamed up with a cardiologist, so they monitored patients during their sleep. And he coined the phrase obstructive sleep apnea. Now, Dr. Christian Guilleminault's most recent papers that have appeared, and I quote, "The treatment of pediatric obstructive sleep apnea and sleep disorder breathing means restoration of continuous nasal breathing during wakefulness and sleep." And this is great news. This is the world's leading father of obstructive sleep apnea coming out and saying, breathe through the nose. And he says we must have our children learn how to keep their lips together and breathe through their nose. And this is not just about children breathing through the nose. It's vitally important for adults to breathe through the nose. I was a mouth breather. I used to wake up tired every morning. We know, and it's well documented, if you breathe through your mouth, you get a reduced oxygen uptake in the blood. You get a reduced oxygen delivery to the cells. If we want to oxygenate the body, if we want to get optimum blood flow to the brain, if we want to get oxygen delivered to the brain, we must be breathing through our nose in a quiet, calm, gentle manner. So really, to get a good night's sleep, what do? The Buteyko method involves unblocking the nose by simply holding the breath. We switch to nasal breathing on a permanent basis. There's 7 different breathing exercises designed to bring breathing volume down towards normal so that breathing is light during sleep. We also practice breathing softly for 20 minutes before sleep to activate the parasympathetic nervous system. And this is especially, important for people, for example, with insomnia, because oftentimes they're so switched on during the day that they cannot switch off during sleep. So by bringing breathing volume down to normal, we help with all aspects of sleep disorder breathing. And let's face it, if we have a good night's sleep, we're going to have a good day. We cannot be productive. We cannot be in good form. If our sleep is off, it has such a detrimental impact on productivity, on our mood, on our concentration, and on our relationships with family, with employers, with school, with everything else. Another aspect that we'll need to look at is determined sleeping position. When we sleep on the back, it does double the amount of apneas, because of course the lower jaw falls back, the tongue will fall back, and includes the airways. So, for example, to get the mouth closed at night, we do use a paper tape. I've been using it personally since 1997, and I can honestly say using a paper tape is a very light, gentle tape across the lips, keeping the mouth closed, getting breathing through the nose. It has been the best thing that I've ever done to improve my energy levels and my quality of life. We've used it with thousands of individuals, and we've had the feedback all the time. All I can say is, if you breathe through your mouth both during the day and during sleep, you're not going to have a good night's sleep, whether you're a child, whether you're an adult. For further information, we have a number of websites. One is Buteyko Clinic International, and also to talk directly with Dr. Mike Milligan. Thank you.